I don't meet a lot of people who look forward to going to the dentist. That's because of the way we treat tooth decay, or dental caries as it's more correctly known. All that drilling, filling, injections. And the worst thing is that what the dentist doesn't tell you is even worse. Because that filling is going to need replaced many times in your lifetime, and every time they do it, they have to remove more of your healthy tissue. By the end of your life, that means you're going to have a root canal or the tooth extracted at more pain and more cost. It fails us as a society because we spend hundreds of billions of dollars treating tooth decay, yet it's getting more present in all age groups. And it fails you as patients. You shouldn't have just one painful treatment that creates more anxiety than anything else as the only route forward. The good news is Reminova can change all of this. We have a treatment that can transform the dental experience. Caries is first diagnosed by a dentist during a dental checkup. He can see signs of decay, and he will typically encourage you to make lifestyle changes. That means better brushing or changing your diet, because your teeth in this early decay stage can actually repair themselves. But most patients can't make those changes. They're difficult, and the dentist has only one option, and that's to give you a filling, and that's the start of that downward spiral. This is where our innovation comes in, transforms the whole treatment. We can repair your teeth back to healthy and strong. No drill, no injection, no pain and no fear. You get to keep your teeth healthy and strong throughout your life. You can continue to try and make those lifestyle changes. And if you don't manage to do that, the dentist can repair it again and again, keep your teeth healthy and strong. Our initial treatment works on the most clinically important initial and moderate caries, but we will extend this treatment in future products so that we can treat more extensive decay. I'm Jeff Wright, I'm the CEO of Reminova. We're a King's College London spin-out, although this technology was developed at Dundee Dental School in collaboration with St Andrews and Abertay University. So we're a Scottish company with an outpost in London. We offer a treatment that repairs and remineralizes initial and moderate enamel caries. We're following a licensing business model, and our licensees will offer dentists an instrument to carry out the treatment and consumable single-use packs which include the chemicals and materials for the treatment. So here's some more information about our company. Our founders are both dentists, Nigel and Chris. They're world experts in caries and public health, and they're also innovators. These are the guys who came up with the idea that Calcivis, another Edinburgh-based dental startup, are commercializing. Steve Howell and myself are the first investors in the company. We both come from early stage company development, and Alistair and Edwin are well-known consultants, providing their skills in finance and regulatory matters on a part-time basis. We've raised money already through a number of EIS compliant investments. We've got some skin in the game. We've all invested into the company. We're trying to hoover up as many grants as we can and squeeze out as much revenue from industry, with some success so far. Our projections require us to have a cash requirement of 9.4 million to break even. This figure could come down based on the licensing discussions we're now having with companies. And our aim as a management team is to turn Reminova into a global oral health company headquartered in Scotland. So we spend 200 billion a year on treating caries. Most of that happens in 8 key markets where there are 1.2 million dentists. That's our customers. In America, in 2016, they carried out 175 million fillings. We will capture some of that market, but that's not the only opportunity for us, because there's typically about 5 times more untreated caries in any population than the number of fillings carried out. So when you scale that across these 8 markets, as we've done in this table, you can see we could be carrying out billions of treatments per year with a huge recurring revenue opportunity. For a young company, we have a very developed IP position, 34 granted patents in all these key markets. The United States was just granted last month. It's all fully assigned and owned by the company. We don't pay anyone a royalty. And we have more in the pipeline, and we're very conscious of IP management in all the agreements that we enter into. This is a great platform for licensing, and we have multiple opportunities. The first one is in the clinical environment with dentists and dental caries. Leading the pack in discussions with us are two multi-billion-dollar companies. We will have follow-on opportunities with the toothpaste brands in the consumer market. They want to see us be successful with dentists first and then have a halo effect into their products. And we will have further opportunities through our R&D and additional clinical studies that widen the applications of our technology. So this is a razor and blade type sales proposition. Our licensees will develop an instrument with us that's quick and easy for dentists to use, allows them to carry out the treatment, and as they treat the patient, they will use a consumable pack that leads to this very strong recurring revenue. This is similar to what they do in other treatments in dentistry, so it fits in with what they're used to. We're looking for 500k to $1 million to complete our preclinical phase, to strengthen our management and technical teams, and to continue our licensing and marketing activities. And this round of funds may get us over the hump and our first clinical license. Through those discussions with licensees, they've told us it's their expectation that they will do all the heavy lifting thereafter. We'll be there pushing them towards excellence and a product launch in 2021. Reminova is very much a one-of-a-kind innovation. There's really nothing like what we do in the market. Our task is to take dentists away from the 100-year-old surgical procedure of drill and fill, get them to start using our procedure, which is clinically superior, which is safer for their patients and for them, and is much more appealing to the public. Now, even with a cautious adoption model, this treatment can go on to become $1 billion product and produce healthy license fees for Reminova. We're projecting that we'll earn over £70 million in 2025 based on a relatively cautious adoption model and an 8% royalty. The instrument's priced in such a way so it creates no barrier for dentists to adopt it, and the consumables are just a little more than what they pay for consumables to do a filling at the moment. These kind of figures will lead to a company get snapped up pretty quickly, and that's just as well because all the companies that we're talking to have a track record in doing just that. Here's some comparators. They're all relevant for Reminova, where you can see the likes of Straumann working with and then acquiring companies that have interesting technology for them. If we're not acquired, I and other members of the team have experience of taking companies through an IPO, and a full market listing would be possible from 2023 onwards. So in summary, Reminova is addressing a $200 billion global opportunity. We have a unique product with a very strong IP position, 34 granted patents at this stage. We have a very experienced management team that's all relevant for the market and what we're trying to do. We have the traction. This is something the industry is crying out for. Not just the dentists and the patients, but the reimbursers and the governments that are behind oral health care. Whilst we have something that's transformative, we're not trying to be disruptive. We're trying to bring the whole industry with us, and I'd like you to join our mission to help transform dentistry.